You're told you need to have pelvic floor therapy, and you're wondering if the internal examination is going to be painful. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County. While pelvic floor dysfunction is the name of the book with different chapters, one of which is incontinence, it's sexual dysfunction, it could be lower back pain, it could be hip pain, it could be sacral pain, sacroiliac joint pain. You could have pain in the pubic symphysis in the front. There are different chapters to this book called Pelvic Floor Dysfunction. And not every pelvic floor therapy requires an internal examination. So in my practice, we typically don't even do that. However, there are cases, not everyone has issues or finds it painful to have an internal examination done. For one, you don't have to have it. If you don't want to, all you have to do is let the healthcare provider know that that's not what you feel comfortable with. Assuming that everything's good and you are okay, the next question is, if you have a problem or you have painful intercourse at the point of copulation, or if when you go to get gynecological examination done and it's painful to put in the speculum, then you have hyperactive pelvic floor, in which case there are dilators, there are different things that can be done. There are things that you could do on your own to prepare the area. So in those instances, yes, it would be painful, and no, you don't have to have an internal manual examination or treatment done. In those instances, almost always in my practice, I would have to say actually always, is we work on the external muscles like the adductors or the obturator externus. Those are the hip stabilizers that we work on. To loosen, we refer the patient to our massage therapist, who's very much trained to work on those muscles externally. So we prepare things from that perspective, and almost always we skip the internal manual treatment or examination. So if you are to receive a treatment for your pelvic floor dysfunction, however you're afraid and so you're putting it off, I want you to know that you do have options, and all you have to do is communicate that with your doctor's office, the therapist, either physical therapist or a chiropractor, or nurses, that are trained to do that. Communicate that with them, and it's definitely an easy thing to handle. If you have any questions, make sure you use one of the methods of contact in the description box to contact me, and subscribe to my channel. Until next time, take care.